Hello everyone, my name is Khadijah Kane and I chose cellulitis for my dermatology presentation. The most common causes of cellulitis typically come from beta hemolytic streptococci, specifically group A streptococcus or streptococcus pyogenes. Less common cases include Staph aureus or Haemophilus influenza type B. Typically, a patient with cellulitis will say that their symptoms were acute. It typically can happen over a couple of hours to a few days. They'll mostly have it in their face, neck, or extremities. The pain is localized. There may be some redness, warmth, or swelling. They may complain of a fever and tenderness to the site. Upon physical examination, the provider may notice some erythema, edema, warmth, petechiae, or hemorrhage within the reddened skin. Hallmark signs are that cellulitis usually happens unilaterally and in the lower extremities. Usually, if it is on both sides of the extremities, the provider may want to look at a different diagnosis. When diagnosing cellulitis, lab testing is not usually required. Just the clinical presentation history are enough to diagnose it. In patients with recurrent cellulitis, serologic testing for beta hemolytic streptococci may be a useful diagnostic tool. When treating cellulitis, it is very important to treat it early. It is also important to determine whether the site has drainage or not. If there is no purulent drainage at the site, it is important just to treat the beta hemolytic streptococci. You can do that by prescribing cenfalexin, amoxicillin, augmentin, digoxin, or clindamycin. If the patient does have purulent drainage with their cellulitis, you can prescribe clindamycin, Bactrim, or doxycycline in addition to amoxicillin. Once the patient is on antibiotics, it is important to monitor them very closely. Ensure that they elevate the extremity in which they have the cellulitis on. And typically, antibiotic therapy will take 5 to 6 days. There are natural remedies that can help treat cellulitis. For example, garlic oil, turmeric powder, coconut oil, baking soda, even yogurt. Garlic oil, for instance, has antibacterial properties that help reduce the redness and the tenderness of cellulitis, and it could actually even completely treat it. Once antibiotic therapy is started on the patient, it is very important to monitor them. If there are no results within the first 72 hours of the patient starting them, it is then important to reconsider the diagnosis and or treatment that was given to the patient. Also, reviewing past culture data can help guide which antibiotics the patient should be on. When educating a person with cellulitis, it is very important to emphasize the importance of recognizing whether their symptoms have worsened or gotten better as soon as they start their antibiotic therapy. If no change is seen within the first 48 to 72 hours, it's important that they call their healthcare provider and schedule an appointment to come back in. It is also important for them to have bed rest and elevate the affected limb as much as possible in order to reduce swelling. According to Teasdale and his colleagues, pain, feeling very unwell, and the need for elevation of the affected limb can result in reduced quality of life and substantial periods of work absence among people with cellulitis. Once the patient has started antibiotics, you're going to want to have them come in within 48 to 72 hours to ensure that the treatment was effective and that the site is getting better. If symptoms worsen, the provider might want to obtain a CBC, make sure there's no abnormalities, and potentially refer the patient to the ED for IV antibiotic treatment. that ends my presentation. Thank you all for taking the time to listen. These are my references, and I hope you enjoyed my presentation. Thank you.